Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about what you can expect from an internal ultrasound. Now, this is going to apply for both a female pelvic ultrasound as well as for an obstetrical ultrasound with baby. But either way, we'll go ahead and explain what you can expect for either of those. Now, why do we need to do an internal ultrasound? That's kind of one of the biggest questions that we get from patients when we mention that we will need to do an internal ultrasound at the end of the pelvic exam. And we need to do a internal scan because if you think about how we are getting the picture from a normal transabdominal ultrasound, so basically from the one that goes up above the belly, we have to go ahead and go through a bunch of different structures basically before we get down to the structures of interest. So not only are we going through the skin and muscle and fat, we also have to go through the bladder before we are even able to see the uterus. So the uterus and the ovaries are going to be pretty far away from the camera. We're going to say, 5 to 10 centimeters down. And because of that, we are not going to be able to get that detail that we need if we are looking for certain things such as endometrial cancer, ovarian cancer. We're not able to do a follicle count on the ovaries as easily if we are looking for up above. As well as if we are checking the pelvis for IUD placement, then unfortunately it can look in place if we are doing it from up above, but then with the internal, it can then show that it is actually out of place. So, long story short, we do the internal ultrasound because we can see everything much better and more clear. And this is simply because we are closer to the structures of interest and we don't have all of the other structures in the way, and we are able just to focus on the uterus and the ovaries and anything in the adnexa. So, if your doctor has ordered a pelvic ultrasound and you are a female, then you can expect that you have to come to the ultrasound with a full bladder. We need this full bladder to be able to see the structures from up above, so from the regular pelvis ultrasound transabdominally. And the transabdominal ultrasound is still used because with the internal scan, as I said, we do see structures with more detail and we do see them up close better. But if you do have a large mass, or if there is something that is just out of reach of where we can angle the internal camera, then the transabdominal, the normal ultrasound, is going to be best to see those bigger structures or those structures that are really up high or really down low. So first you're going to come in with a full bladder, and then you are going to come into the room. We're going to go ahead and do the exam as usual from up above, and then we are going to get you to go pee. It's really, really important for you to try and empty out your bladder as much as possible before you come back in for the internal portion, because although it does help us see from up above, if you have anything left in your bladder, and especially if you have too full of a bladder for the internal, then we are not actually going to be able to see those structures as well, because the bladder is going to basically make it so that there is a really kind of like bright artifact look to our internal scan, and that's something that we really don't want. So that's why we are always going to get the patient to empty between the transabdominal scan and the internal scan. So once you're done going pee, you're going to come back into the room. And for me personally, I do like to use a wedge for underneath the patient's bum. So it literally just looks like a wedge that you put on the bed, and it's made out of foam and covered in some plastic. But essentially, we are going to get you to change from the waist down. So take off the pants as well as the underwear. And then you are going to go back on the bed and you're going to have your bum on top of this wedge. And it's going to feel like you are doing like a bridge, essentially. Your bum is going to be lifted up, and then you are also going to have a drape to obviously cover yourself. This is all going to be done when we are out of the room. And then when the patient is all changed and into position, we are going to come back in the room. Now, the reason why your bum is on this cushion and why it has to be kind of at this angle is number one, it is easier for insertion in general of the camera. As well as number two, sometimes structures do move around a bit and we can't actually get to these structures unless we are angling around. So the cushion just provides a little bit more of an easier time for us to be able to angle the camera. Anyways, afterwards, we come back in after the patient is done changing and getting into position, and then we are going to go ahead and prep the camera. Now, the camera itself is probably about like that big altogether, but most of it is handle, okay? So like basically all of like this is handle, and then only about this much is going to go in. So we're going to say about the thickness of a tampon as well as the length of a tampon is going to go inside, and nothing more than that. But for the majority of patients, they find the internal not too bad. It just looks really intimidating with the wand, but I promise you it is mostly all handle. And if you do use tampons regularly, or if you've had like a pap exam before, you really shouldn't have too much of an issue with the internal scan if those things aren't causing you too much trouble. Anyway, so we go ahead and prep the camera. At the clinic that I'm at, we do go ahead and use sterile probe covers. I know some other clinics do use condoms, except for patients with latex allergies. But either way, there is going to be a probe cover on the camera so that there is no risk of transmitting any sort of like fluids or infections from patient to patient. And our cameras are also washed and sterilized between each patient as well. But anyways, so we go ahead and we put the probe cover on, and then we also put some gel on the end of the camera as well, just to help with insertion. This gel is usually pretty chilly, so beware of that, just because it is a sterile gel. And we cannot warm up that gel because, obviously we don't want to be introducing anything that isn't sterile to the inside of the body. But then what I do is I go ahead and give the patient the camera underneath the sheet, and I get the patient to insert the camera. This is again going to be a personal preference of the tech, but I believe most of us do get the patient to insert the camera just for the level of comfort for the patient. Obviously, they can go ahead and insert at their own pace, as well as if it is too painful, then they can obviously stop the insertion. And you also know your body better than me, so usually it goes faster if the patient is able to insert it. But in those instances where the patient cannot, or they just want me to insert it, obviously I just go ahead and do it for them. But I always make sure to go really slow and just check in with the patient constantly just to make sure that they're doing okay. And during the exam as well, since we are kind of angling the camera back and forth and up and down and, obviously left and right, we do need to check in with the patient too, just constantly throughout it to make sure that they're doing okay. And the exam itself, for me anyways, it lasts about a couple of minutes or so, is how long we have the camera inside for. Sometimes it does take a little bit longer, especially if we have to image anything abnormal or if we're having issues getting the pictures. And during the scan, the tech might also ask you to take some breaths in to clear out the bowel gas. They might also even get you to lift the bum off the cushion if certain structures are just out of reach and they're not able to angle up that far. But overall, the exam shouldn't be overly painful. If it is, please let your technologist know, or please just let them know if there's like a certain area that is tender, or if you want the exam to stop altogether. That's absolutely your right as a patient. And I forgot to say this at the beginning, but if you do not want the internal done, that is also your right as a patient. We are not going to force you to do anything. And although we get much better pictures from inside, if for whatever reason you are not able to do the internal or you're just not comfortable doing it, you can always go back to your doctor and discuss other options of what other imaging can be available to be able to see those structures of interest. Anyways, so we go ahead and, obviously we take pictures of the uterus, the ovaries. We're also looking in your nexus and making sure that everything looks okay there for a female pelvic exam. And then after we're all done, we're going to go ahead and remove the camera. And then I go ahead and I take the probe cover off. I wipe it down in the room just with one of our cavi wipes. And then I take the patient down from the bed, as in, I forgot to mention this as well, but during the beginning, before I do the insertion, I do bring the patient up on the bed, as in like I lift the bed up pretty high because I scan standing for my internals. I don't sit in the chair. So that's why I go ahead and bring the patient up on the bed. And then obviously after I take out the camera and I get it cleaned off, then I go back over to the patient and I lower the bed down just so that they can get down safely from the bed. Then I let them know that there are tissues on the side for them to get cleaned up with and to not touch any of those cleaning wipes for our machines, obviously. And then after that, they are free to go. At the clinic that I work at in Canada, we are not allowed to give any results to patients. So therefore, the patient can go like 99% of the time. If it is something really serious or something that needs to be dealt with right away, then we will go ahead and call the radiologist or go speak to the radiologist, and they will decide whether or not they have to come in to talk to the patient. Again, most of the time they don't, even if it's something that is urgent, as they can call the doctor and basically get the patient's family doctor to talk to the patient about it. So, anyways, for the most part, the patient can just go right after we are done the exam. So, that is how internals are going to go for a female pelvic ultrasound. But for obstetrical ultrasounds, they are just going to be a little bit shorter in general than the female pelvic ones because we are looking at less things than what we are with the female pelvis. In the first trimester, if you come in and you are a little bit too early for us to be able to see well from up above, and we are not able to see a baby from up above, we are going to go ahead and suggest that we do an internal. Or again, if you're not comfortable with that, you can always just rebook for a couple weeks out from the time of your exam just to be able to hopefully see baby from up above. But if you are okay with it, we'll go ahead and we will proceed with the internal just to see if we can get a better look at all the structures from inside. The procedure is essentially the exact same, but as I said, it might just be a little bit shorter because we are looking at fewer things with the obstetrical ultrasound in the first trimester. And in the second and third trimester, you might still actually need an internal ultrasound if we cannot see the cervix from up above. So, this is why it's super important for you to still come with a full bladder for all of your obstetrical ultrasounds because it does help us see better. But if not, we always have the internal scan to be able to see everything better. Now, in the second and third trimester, the only time that we really do an internal is if we are trying to see the cervix. And in this case, basically, we are going to have the transabdominal one done from up above, as in just the regular scan of baby, and we're looking at all of baby structures, etc. And then after the exam is all done and I've shown the parents the baby, I will go ahead and get mom to run to the bathroom, again, pee everything out of her bladder. And then she is going to come back in. And instead of having that wedge on the bed, I just have her laying on the bed with obviously a pad underneath her bum so that it's not just like touching the bed directly. But I don't need a wedge for the second and third trimester because, first of all, it is hard to get up on these things for some patients. And especially if you're pregnant, that is going to add a whole nother level of difficulty. But secondly, we don't really need to angle around for the structures like we do in the female pelvis. So if we just have the patient flat on the bed, then almost always we're able just to get the cervical measurement without any sort of angling required. And since we are just checking out the cervix during the second and third trimester, if we need to do the internal scan, it'll last a maximum of like 1 minute. Usually I'm in and out of there in about 20 to 30 seconds. So these scans for the obstetrical ultrasounds are going to be much quicker than if we are doing just a regular female pelvis that is not pregnant. But hopefully this has cleared up some things if you have never had an internal ultrasound, because a lot of the time, even when doctors order these ultrasounds, the patient doesn't know that there is an internal component or they haven't ever really heard of it before. And since ultrasound is becoming more and more popular to order to actually go ahead and take a look at things in the pelvis, it is good to know that there is an internal component present for a female pelvic ultrasound. If you are okay with that, again, right, you can go ahead and refuse it. And also, as a side note, we don't do the internal ultrasounds on someone who is not sexually active. Hopefully, that is self explanatory. But also with the obstetrical ultrasounds, just be prepared that if we can't see everything well from up above in the first trimester, we will then suggest to do an internal. And in the second and third trimester, if we can't see the cervix well from up above, we will also need to do an internal ultrasound if the patient is okay with that. And like always, if this video was helpful for you, please like, comment, and subscribe. And also check me out on TikTok. I make videos over there as well.